So compassion. So we're going to move on a little bit from the stress, and then I'm going to bring you back to it again after the break and show you some of these heart-wrenching videos. It's not just that they're heart-wrenching. There are real parents talking about real experience, so I think it's very helpful if you can see it. So compassion, and we're going to talk about the two sides of it, which are compassion and fatigue, satisfaction and fatigue. So empathy, which I've mentioned to you, that is a prerequisite. So if you don't have much empathy, in some ways you're well off because things aren't bothering you. But on the other hand, you don't really get any satisfaction out of experiencing compassion. So you must have empathy. You must be able to relate to another individual's experience. And when you do that, the same neurons, etc., are firing in your brain as if you were experiencing that, if you have good empathy. So if Deborah is crying and I'm watching her cry, I'm going to start to feel sad, and I may even cry, even if I don't know what she's crying about, because I'm experiencing it, okay? So Dacher Keltner, who is a director, he's a psychologist and a director of the Greater Good Institute in Berkeley, and I would really suggest, this is one of the resources, I believe it's in the references, that you check this out. There's a website there that they've made very parent and user-friendly. That's all about wellness, and there's courses you can take, etc., and most of their stuff is free. But I have a video clip of him where he talks about compassion and it being a particular evolutionary survival mechanism. So that's a picture there of bonobos, which are a type of primates that are deemed to be quite similar to humans in a lot of ways. And they demonstrate and experience compassion. So it literally means to suffer together. So empathy is experiencing that emotion, which could be positive or it could be difficult. But compassion is when you notice somebody else suffering and you're suffering alongside them. And emotion researchers have defined it as a feeling that arises when you're confronted with another's suffering and feel motivated to relieve that suffering. So if you just notice it, and so psychopaths, for example, notice suffering and are not motivated to change it. That's why, you know, when people are curious about, say, Ted Bundy, who was a psychopath or sociopath, he could very well understand emotion. He could come across as very charismatic, which you have to have good empathy in order to be able to come across, because you know what you're saying or doing is impacting someone in a positive way. But then he didn't have the suffering when he saw them suffering. In fact, he probably had some joy out of it. So the compassion is when you feel motivated to alleviate that. And Dacher, sorry, I have a hard time making sure I say his name right, talks about Darwin's research, which many of us haven't paid attention to, in that this survival of the fittest doesn't mean survival of the meanest. And we often think about that like the biggest, the toughest, who's gonna survive. But he also talks about the survival of the most compassionate. Because in order to have a well-functioning society, and we're social animals, we need to be able to support each other, or we would just die out. And so in order for primates who live in social groups, or humans to live in social groups, to do well, you need to have compassion. And parents absolutely have to have it if their child is going to do well. Just think if you're a parent and your child is having a hard time and you're not triggered by that in any way and you don't want to alleviate it, what is going to happen to that child? So all the stuff on attachment and all of that, if you're not able to notice and then engage, your child is going to have a harder time. So it's absolutely necessary for parenting. And then a good and bad thing that happens is when you get pregnant and then when you have that child, all these hormones elevate to make you much more attuned. And therefore, a much more engaged and competent parent, but also much more vulnerable to the stress of that. Okay. So later I'm going to talk about self-compassion, but whether it's compassion or self-compassion, Kristen Neff and Chris Germer, who are the authors of Mindful Self-Compassion, I'm going to talk about later, talk about this, and they're not the only ones to talk about it, but they do talk about it in their programming, of the yin and the yang of compassion. And so the yin being that comforting, that soothing, that validating, But that's not the only thing that's compassion. There's also the yang. And so the yang is that strong compassion, like that urge to protect your child, to advocate, to provide. But it's also motivating. And so, for example, if I'm feeling some pain or suffering, I might hold my heart and try to give myself some kindness. And if Deborah is feeling some pain or comforting, if it weren't the COVID, I'd reach out and give her a hug possibly, or things like that. But I also might notice that someone's bullying Deborah. And I'm triggered by that and want to provide some support. And so I feel it and I say, that's enough. Because I care, just conscious of the mic, because I care, I'm stopping this. So there's both things that are happening, yin and the yang. So keep that in mind. It's not all just, fuzzy and warm. It's both. And so here's the mother bear. And she's providing, it looks like a nice, cozy little environment for her child and looking after him. And bears can be so cute. I mean, I've even seen grizzly bears who are pretty fierce-looking things, just look so sweet and cute with their babies. And here's the mother bear when her cubs are being threatened. So there's the yin and the yang. And I really like those pictures because, I know I've looked like that a lot of times. Probably got my teeth cleaner though. And then I've also been on the other side. So think of that mama bear, right? Really able to be kind and tender and also able to take on the predators. Okay. But also think what would happen if all that bear ever did all day long was take on predators. Like they don't do it all day long. They do it rarely. So the good side of compassion and caregiver satisfaction, this is a phenomenon, are those positive experiences. So cognitive thoughts like, I'm doing a great job, this feels really good, look what I did and I made him or her feel better. It's emotional, you feel joy, you feel warmth and love. And behavioral is often doing more of the same thing because it's so reinforcing to you. So you feel strengthened, you feel empowered. You feel accomplished. I did a great job, right? I made this dinner and they all love it, right? You're connected. You feel appreciated. So your self-worth is really going up. You're feeling great. That's the so-called bliss, I suppose, of parenthood. And it does happen and it can happen. You're positive about yourself and in your role as a caregiver. So as a parent but also a caregiver in a professional setting, when you are effective with your clients, you're feeling good about it. Like, I'm such a great nurse. I was able to help these patients. Or I'm such a great EA. Look what I did. He was having a meltdown. I put the supports in place and we did the calm down routine. And he's back at work now and doing great. I feel good, okay? Something we know just specific to parents of kids with special needs is an added positive is that they can learn to appreciate and recognize different values and meaning in life that they may not have thought about before they were a parent because they've, experienced so many different things. And also a deeper understanding of others and a greater ability to be compassionate to themselves and others. I know myself, before I had children, I thought I was fairly compassionate. But after I had children, I obviously had the understanding of what it was like for these parents. As a teacher, I worked with students with behavioral and social, emotional challenges and learning disabilities, etc. And I can think of, being 27 years old and thinking, gee, these parents could and should be doing all these things differently. I didn't say that to them, but I for sure thought it. And then when I became a parent myself, and then I reflected back, you know what? Some of those parents were doing so much better than I am right now. I had that greater ability. And now compassion fatigue, if you look at Figley Institute, Figley and colleagues have done a lot of research on this. This is the emotional and physical exhaustion that can come with the fatigue. So feelings of irritation, anxiety, hopelessness, depression, feeling very diminished in your ability to feel and give that compassion. It's often called the negative costs of caring. So I'm quoting that because Figley, but many others use that. And it's normal. So keep in mind, this is a normal response to when things are challenging or overwhelming. And it's experienced by many, many parents and individuals who care for others. It develops over time and in stages. So I'm going to fairly quickly go through this just before the break. So there are stages of this. So the first stage, the zealot, there you are, superwoman. You're keen, you're committed, you're going above and beyond. So an example is new parents who say, I'm only using cloth diapers and I'm only washing them in, you know, in organic flowers, and I'm air drying them in the sunshine, and I'm going to move to South America to make sure there's enough sun for that, and it'll all be organic and only be used by this special blender that doesn't have plastic. And you're reading up on every aspect of the parenting, and then if you have a child with disability, everything you could possibly ever know about disability. And I tell you, those parents know more than you. If they've done this, if they've been a zealot, they know it. So I'm therapist, I'm nutrition, I'm volunteering to be the baseball coach so that my child can participate. But you know what? That's the first stage of you're going to develop compassion fatigue, because how long can you be superwoman? So then you get into this, I love Grumpy Cat here. You realize you're unable to meet those expectations. Geez, I didn't actually make enough organic food, and I opened up that jar of apricots with sugar in it because that's all I had. And you start to avoid or resist. So that's where that, like, I'm fine, I can handle this, because you want to be strong. You become frustrated with others and your child, and you use a lot of sarcasm. So, you know, for example, your therapist wants to work with you, and you're like, sure, I'd love to attend another therapy session where you coach me how to control his tantrums. Going so well. Yep, be there tomorrow, right? So, and you do it to your child. Like your child says, Mom, you know, you're like, come on, you know, Johnny, it's time for dinner. And he's like, can't I just keep playing my video game? And you're like, sure, Johnny, play it all night, right? That sarcasm is coming from this place of, I don't know what to do. I'm frustrated. I'm agitated, right? I had these expectations. I'd be able to do it better, and it's not working. And so you don't talk about the real issues with anybody. And so here's the problem, right? And you distract and redirect because it's too painful to think about, I'm not doing this well enough. Then beyond that, you keep that up, you start to withdraw. So here's Mom here, and the child's not getting engagement, right? You're drained now. And so you start to feel sad and isolated and hopeless. You avoid your child. It's like, you know, I can't really help them, so I'm going to pretend that all this stuff's not going on. You might leave it to the teacher or the babysitter or the video game. And parents who don't attend school or treatment meetings, and I've encountered schools where they say, you know, don't count on that parent to come. They're just not engaged. They never come. And when I hear that, then I say, why do you think that is? And maybe something to consider is that parent is at a stage of difficulty where we as professionals need to be providing them with some more support. There could be other reasons. I mean, they could be a fashion designer that's flying around the world. But the likelihood is, and I would err on the side of this, is they need even more compassion and support from us as professionals because they're going downhill. They're struggling. So you withdraw, and then you continue on, you become the zombie. So I actually really love this picture that I found because the little child hanging from her neck, like he just looks like this little evil thing, right? Like, okay, I'm going to continue. And the daughter is maybe like just asking for something like, Mom, there's a strange guy at the door, can you help? And then the baby's screaming. So you're on automatic pilot, you're not having fun anymore, you have no patience, no compassion, but the terrible thing is, you still feel, I'm the only one who can do this. I'm exhausted, but I'm going to do it anyway. So if I had an audience, I say, how many of you have felt like this, have felt exhausted and fatigued and incompetent in your parenting? And you know, some parents put up their hands, or maybe a lot of them, and they go, how many of you are continuing to do it anyway? They put up their hands. Well, here's how you are. And then that hopelessness can turn into rage. So rage at others, that's when you can have domestic violence occurring. That's when you can have violence towards the child, aggression, verbal, etc. And you're raging at those professionals. So when professionals out there, if you have a parent coming in raging, please try not to take it personally. It may really not have a lot to do with you. It may be their frustration with what's not happening in the school, but it may be this is a reflection of where they're coping emotionally with all that they're having to handle. And then the final stage can either be unwell, burnout, so you go up in flames, or you renew and you develop resilience. And we know this happens. And we also know that those stages aren't exactly linear, like they sort of one comes after the other, but you can bounce around. Have a look at those slides and have a look at those stages and identify where you are or even where you've been on those stages of compassion fatigue.